important panel discussion that is on communication on non-vocal children on spectrum. So, I am Subhendu Kumar Barik. I am myself a father of a 5-year-old child on the spectrum, and I will be moderating this session. So, I request all our esteemed panel members to take close to 3 or 4 minutes to answer his questions, so that we have close to 5-10 minutes to take up questions from the audience. So, now my first question will be to Dr. Smita Awasthi. The question would be related to sign language. How sign language helps non-vocal children, and does it restrict emergence of vocal or emergence of speech or transitioning to being vocal?
Thank you very much, Suvendu, for asking me that question. When a non-vocal child comes to our clinic, and what do? We need to teach the child communication, and there are various methods that are going to be discussed today. One of the options is using sign language to teach the child. The moment we say we are going to begin with teaching the child to use sign language, which means we are going to prompt the child to use a sign so that the child can learn to communicate and ask for what he wants, the parents are very hesitant and they feel that it is going to block the development of the speech, and the child will become dependent on using sign language. So, we've looked at research that has been done in the past, and I have been fortunate that I was enrolled at Queen's University, and I did a long study of 6 years, 8 months. And in this period, we used the sign language protocol with almost 126 children. And the results that we got from that was 80% of our children developed some speech. Now, when I'm saying some speech, I'm saying some children, almost 50 to 60% children emerged with words. So they were able to use words, and the remaining of the 80% children, they emerged with phonemes. So they could say single sounds, single syllable sounds, and that's how they emerged with speech. So the fear in the parents' mind that if we use sign language as a way of teaching communication, then it's going to block the development of speech. At least the research is not showing that. So research has been showing very positive things about using signs as a way of communication and possible emergence of speech. The age range over here that we have worked with and I've got results with is 1 year, 4 months to 12 years, 2 months. So the oldest child who developed speech was 12 years, 2 months. Recently, one of my colleagues, she used the same protocol with a 19-year-old boy, and she said that the child is just talking. He was speechless and he's talking. So that is what I would like to say, that firstly, because we need to give a way of communication, we should not fear using sign language as a way of communication.
Thank you, Smita ma'am. And I would like to add something to it. It's from my personal experience that what she said that has been applied to my son also, and it has worked on him. My son was completely non-vocal, and she applied those things on my son, and he is vocal now. So I am a proof of that. So if you don't agree with her as a parent, I am a proof of that. So my next question would be to Mr. Doug Stromberg. How does picture exchange communication system help children with spectrum? I mean, how does it help in communication?
Well, talking about picture exchange communication, I suppose we refer to the method that is also called PECS.
Exactly.
So this is a way of teaching children or older people, individuals with communication difficulties, to initially to make requests, to show other people what they want. And a method that has very clear steps. So if you follow the method, it has been shown that this can help individuals to acquire functional communication. That means instead of maybe pulling the adult by the hand or pointing or screaming to get what they want, the child learns to take a picture and hand it to the other person in order to get something. So it's an effective way of learning functional communication that will also, just as with sign language, if you use it for communication, for requesting, it will also reduce the risk of problem behavior.
Yeah, and anyway, does it help in emergence of vocal language? Anyway, there is any evidence of helping in children?
I would answer a bit similarly as what Dr. Awasthi said, that there is no risk that picture exchange will hinder speech acquisition. There is some evidence that it may help acquisition of speech. Personally, in my clinical experience, I have met several children who have developed speech while using the picture exchange communication system.
Thank you. Thank you, Mr. Dutt. So, my next question would be to Mr. Venkat Raman. So, as you are a speech pathologist, so there are so many techniques available, right?
Yes.
So, I mean, how to decide, which one to use on the kids? Because every kid on the spectrum has different needs. So, how do you decide which one to use? How do parents know which one to use?
Okay, so we have been seeing the presentations. It's not limited to only non-verbal kids, non-vocal kids, but the vocal kids as well. Yeah, not only the non-verbal kids, but the vocal kids, verbal kids also need some kind of intervention when it comes to communication. So we as individuals, we prefer different shirts, different food, right? The kid also needs different systems. So what we have to do is we do follow assessment procedure, and we see accessibility of the child, preference of the child, give options, try out 2-3 different things, and then see which one is more effective, what the child is responding well to, which technique. Now coming to different techniques, when we are discussing about signal generating devices like high-tech dedicated tablets or sign language or PECS, right? Each system has a basic functionality. Like when you talk about signal generating device, the dependence on a device is more, and the dependence on a communication partner is less. When it comes to PECS, the communication partner's role is more, but the arbitrariness reduces. Everyone, when you show a picture of food, everyone in the society will understand it's food, right? And when it comes to sign language, though it doesn't need any kind of aid, but arbitrariness is more, and every person in the community may not know the sign language, right? So it depends on the child's need, the age, cognitive level of the child, parents' literacy level, everything.
Okay, so it basically depends on the assessment and,
yes, exactly.
And the trial of different things, which one works on the child.
Yes.
Thank you, Mr. Venkat. So, mine to Ms. Gunjan and Mr. Venkat also, both of them can answer. So, we would like to know what are the alternate techniques which are useful for non-vocal kids on ASD. One thing is sign, one thing is text, and what are the alternate techniques which have been successfully used on the childs on the spectrum, which has actually worked?
So apart from signs and PECS, we have speech generating devices, which are also a form of augmentative and alternative modes of communication. These days, everything is moving to technology, so why not this as well? Speech generating devices literally give a voice to the student. The research says that, when you want to transfer to speech generating devices, it's actually evidence-based is that you move from PECS to speech generating devices. You start with PECS, you move on to when the child reaches the phase 4 of PECS, when they are communicating with the partner using, the sentence strips, when they're communicating, I want blue ball. At that phase, it's a good time to move to a speech generating devices. We're in Hyderabad, and Hyderabad has their Avaz app, So that came from Hyderabad, and that's a wonderful Indian-based app that we have for our students. Apart from that, there are a lot of other apps as well. Proloco 2Go is another widely used app, and in my experience, I've actually seen that really benefit, the communication aspect of the child. It gives the voice to the child, especially for children who have better receptive understanding. The voice, the auditory discrimination and the auditory feedback that they get from pressing the button gives them, gives them a better opportunity for communicating and being more independent.
Ma'am, there are many apps available these days. Any word of caution to parents while selecting those apps to help their children?
I would say, in my experience, I have had an experience of Avaz and Proloco 2Go. When selecting the app, you need to see which app can be more customizable for your child. Let's say when it comes to Avaz can have the voice which is characteristic of, Indian boys or Indian girls. So we always say that when you have a speech generating device, it needs to be customizable. Apart from that, affordability is another aspect. The Indian app is much cheaper than the apps that we get, the other apps that are there internationally. So, plus, if there's a training on the app, the parent training component of the app is very important. Avaz in itself has a component of training the parents on how they can use it and how they can contrive situations where they can teach the child to use the app more efficiently. So it also depends, and I guess the decision is with the whole team. It's the therapist, it's the speech language pathologist, and the parents. It has to be a combined decision from all of them.
Thank you, ma'am. You want to add something, sir?
She said there are so many commercially available apps in the market. Some of them are purely free, no cost at all, but it needs a lot of customization. Some of the apps which is very a lot costly, and we can use it very easily, and the parent training and all those things are easy, like Touch Chat HD and Proloco 2Go. Those are the expensive ones.
Okay, thank you. So my next question would be to Mr. Sridhar. So there are so many techniques to help communication with non-verbal child, but we don't know, there is a possibility that the child may move from being non-vocal to vocal. Right? So can a child become dependent on these alternate techniques so that the transition to being vocal won't be that smooth, or it may not happen because he is so much dependent on these alternate techniques?
Okay, I read a book recently called Essentials for Living by Dr. Pat McGreevy. It opened my eyes to a completely new perspective, on the whole thing. What I find is what they say is, even the children whose vocals emerge, it is not as if they are going to be speaking fluently hundreds of words and sentences, it may not happen. And again, when the vocals emerge, how often is it intelligible, understood by strangers, people who are not, I was giving the example of a child who says bucket when he wants a biscuit. Mummy knows, oh, bucket, he's saying bucket, here's a biscuit. But suppose he goes and asks in a shop for a bucket, what is he going to get? So there is a problem of intelligibility. So the authors of this book, they recommend that some children, if you do a detailed assessment, they may need an additional method of speaking. So even if you have vocals, you may still continue to use signs or PECS or a speech generating device so that your audience can understand you more clearly. Okay. So that is one of the things that I would like to say. The second point, just reflecting on something that they said about SGDs. See, it's not only about emergence of vocal, it's about communication, right? Now, a child who has difficulty in producing sounds, maybe manages words but has no phrase speech. This app can be very useful, things like Proloco 2Go, Avaz, because if you ask the question, when is your birthday? How old are you? I'm 19 years old. 19 is very hard to say. Whereas you can program it on the app. How old are you? The child is able to understand the question, presses appropriate button, which, with 19 written on it, or some icon we teach her to press that, gives the answer. Or what is your home address? 824 Embassy Pristine, 21 6th Main Road. Never going to be able to say all of that. What is your mother's mobile number? So I have had one successful small experience of training my daughter to answer these questions using a SGD. Though she has a 30-word kind of a speech, 30, 40 words she can say. But this was still, as a supplementary tool, very useful. Next step, I can also think about, can this be useful for her to have some interactions with peers? Your inability to speak should not stop communication. So there are, so I would say keep an open mind, see which one works for you best, and keep a backup option, an alternative method of speaking in hand.
Thank you, Mr. Sridhar. So my next question would be to Dr. Leena. As you are a speech pathologist along with a behavior analyst, so my question is more related towards behavior. You must have worked with many children, many non-vocal children on the spectrum. So what is the impact of using these techniques on the behavior of kids on spectrum? So generally, non-vocal kids with age tend to get cranky, get upset, get frustrated. I mean, how does using these techniques work on their behavior? Is there any significant improvement or anything else?
It's a good question. Again, I thank you for all your questions because they're all valid, and I'm going to talk off of that as well, saying that it's very important to go back to individualizing the way of communicating, because the effort is very high on children that have difficulty communicating, that if we choose the mode, then the problem interfering in problem behaviors will be seen even more. And so it's important to find out what the child's preference is first and the way a child is communicating, and then build on that. So if the child is has great motor skills and is responding to gestures and is comfortable with manual prompting and has immediate access to what he or she wants by using manual sign, then that's going to help that child access his environment quicker, easier, and therefore less problem behavior will happen. We're all people who want to communicate, right, in one way or another, whether we want to communicate to leave me alone or give me something or let me run away from what you're trying to give me, right? So we're trying to communicate. And so finding out what's the best for the child to use for that venue is important. So teaching effectively by starting in small steps and following effective and systematic teaching procedure to teach those, whether using a low-tech device, PECS, or a speech-generated device, or manual sign, or phonetic hand cues, whichever there is. Follow the child's preference first, figure out what they want for preferences, adjust to that by teaching systematically sound teaching procedures with any of those augmentative alternative communication systems, and that will really be very successful in having the child seek, access, communicate, navigate the environment, manipulate the environment to, and have the listener, us, the environment, reciprocate and respond appropriately. So I think it's a crafty thing to think about. First, individualization, great, systematic, clear, effective teaching for any of those modes, and doing it for helping the child access the environment quickly so that the reinforcers are right there, immediate, and then building on those. So it doesn't mean that if you start with manual sign, you can't later on use any other alternative augmentative communication system. you can surely start there and then change and adapt, or maybe add and complement, which the literature shows is a good thing to do, is to augment interventions as long as they're systematically implemented, specifically to produce accurate speech and to expand on the language and the speech production.
Thank you, Dr. Lina. So, if I conclude from this discussion, then all these systems, helping systems, or let's say PECS, everything, that helps kids in spectrum, right? It doesn't, create any sort of problem. It's not a problem. And it helps to, in certain way, it helps to calm down a child on the spectrum so that he could communicate in some way or other. And it's not a, it's not a problem for a child to, it doesn't create problem for a child to migrate from being non-vocal to vocal. It assists a child from being non-vocal to vocal. So these are all support systems which indeed helps a child. So we are open to few of the questions. We have 5-10 minutes to take up questions. So if questions probably.
Thank you.
But we will be happy to take your question offline. You can exchange numbers and we can talk about it. It's a question that I would like to address. Definitely, it's an anxiety we need to answer. We'll do it offline. Any questions on, as he suggested, the communication systems?
Yeah. First of all, I would like to appreciate all of you for giving a lot of insight into communication and the different ways in which we need to work with different children, because each child by itself is an individual case. I would like to give a certain example. I have been working with these children since decades. An example from my work experience, which will be a point for everyone here to reflect on, including the panel. Here is a boy, Hussein, who's asked to do something by his teacher. Let's say the teacher said, Hussein, I want you to do this task. And he doesn't do. The teacher keeps repeating, knowing very well that he can do. And he has been doing. And then the teacher says, why are you not listening to me? And Hussein replies, I am listening to you. The teacher keeps saying repeatedly, you are not doing what I am asking you to do. And you say, you are listening to me. He says, yes, I am listening to you. I would like the audience and the panel to discuss on this and throw a little bit of light as to what actually is going on in the processing regarding speech and communication.
Yeah. I think this question is, bit of out of context. This discussion is, related to communication techniques on non-vocal children. So can you please keep your questions to the context on which we are having discussion here?
I think that was a very interesting scenario you have presented, and it does require a little thought on why the child is not responding and is saying, I'm listening, and really are we discriminating between the listening behavior and comprehension and making a response. So maybe those are the things we might need to deliberate with and think about it. Just kind of a quick one.
Okay.
Madam, can you show a bit of videos about the PECS systems communication? Is it possible for you?
We don't have videos for the panel discussion.
Videos, sir, yes. At least can you explain verbally
Maybe,
the PECS
maybe
system?
we can show
it's
you
very useful, but it didn't cover the much.
We can cover.
Just say it, Rachel.
Yes.
Thank you very much.
Hello.
I can show.
Okay.
We can give a very, very short demonstration. Lina, if you... Okay. Let's say I am a child who has no vocal language. I like water. I am thirsty right now. So water is something I want. I get this picture. Let's pretend it says water. So what I have to learn is to take this picture, give it
Water.
and I will receive what I want. So that's the first step in PECS, is that the child learns to pick up a picture, give it to the communicative partner who says the word and immediately gives the object. And then there are several more stages. The child will have a book with the Velcro and will learn to take the picture from the book in order to get what he or she wants. And then there are more stages. So the child will learn to take the correct picture if there are several pictures visible. So to receive what he wants. So you will introduce different objects that the child likes, and the child will learn to take the correct picture and learn to be persistent in his communication, to not only give a picture when the communicative partner is close by, but on a distance, to walk, to be persistent in the communication. So that's kind of the first steps of PECS. Was that? Thank you.
Thank you. So,
when you begin doing PECS, make sure that you do it with someone who has learned the method correctly. Because there are details in this that I cannot show you right now, that it's easy to make some mistakes, and you need to have a professional guidance to do it.
thanks Mr. Dutt and Dr. Lena. So, thanks to all our esteemed panelists.
Good evening. One question. Do we have any graded level certificate to issue to a child so that the child can go to a normal school? The child has achieved, say, 300 word, 30 word. It can go to, do we give any certificate? Is it leveling the child?
Excuse me, ma'am, and this question doesn't fall in the context of this discussion.
No.
Please.
Yes, I know that. Yesterday
Sorry,
I wanted
I'm
to
sorry.
ask.
I'm
Yes.
sorry, but it's not in the context of
Yesterday
this
I
discussion.
wanted to ask. They said,
You can ask later when you
I
get
think
hold of them.
many of you would have similar questions. Just take one of our business cards and let us talk it over. We'd definitely love to answer these questions, but at another time.
Just can you 1 minute, please? One of madam, she asked about he's not listening. Am I right? The children with autistic spectrum disorder will be having sensory processing difficulties. Whether it may be auditory or visual or tactile or gustatory or all 5 sensors. So it is a sensory processing difficulty. In that scenario, I think about that child, preferably what I want to convey is, it's a intentional behavior of the child. He is too smart than you, the trainer. He is a trainee who is an intelligent boy. Autism, is a mysterious. But having normal IQ, sometimes above normal IQ levels. Got it? So he's a mysterious.
Excuse me.
So intellectual.
Excuse
he's
me.
intellectual. Thank you very much.
We need to close out this discussion. We are getting delayed. Thank you. So thanks to our eminent panelists. So thanks for your valuable feedback. Thank you.
Excuse me. I just want to tell the lady who talked about communication. We at Swayam Krushi have communication pouches. It's very easy to carry for the child, and depending on the situation, they can pick up the picture and show. So Swayam Krushi has designed it instead of communication boards, the child looks very normal as though he is carrying a bag. He doesn't look abnormal. At Swayam Krushi, we have those pouches, and I want to tell that mother, she can come and take one from us. Thank you.